Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about the diabetic foot. This is a common thing that actually we see on a regular basis. Basically, the diabetic foot is an individual that has diabetes and the side effects or complications that can happen with the foot. So the diabetic foot basically has four components. Number one, it has a lot of times will have an peripheral neuropathy problem. So you actually have the nerves that are malfunctioning, not working like they're supposed to because of diabetes. You actually have decreased feeling, can have decreased balance. You can have discomfort, but typically it's usually a numbness, tingling, lack of pain. That's the problem with the diabetic foot. Number two, you could have a problem with circulation where the blood flow to the feet are not as well. If you sugarcoat a blood vessel, it doesn't work as well as it should. Number three, you don't fight off infections as well. So you actually sugarcoat the immune system, for lack of a better way of saying it, as well. And what happens is you don't fight off infections, you don't react to infections, and a lot of times you have less of the symptoms that you should have even from an infection. And number four, the diabetic foot is notorious for having wounds that are poor healing because of the circulation, because of the neuropathy, so forth. And so you actually have sores that present without too much warning, and a lot of times can be problematic and not heal, and over time can lead to other problems. So when it comes to diabetes and the complications that come with diabetes, the diabetic foot is and can be a huge problem. So I recommend that you actually have your feet evaluated on a regular basis. So that being said, if there are any problems with your foot and you have diabetes, it is recommended you be seen so you can actually determine if you have any of the other associated problems that come from diabetes. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 275, the diabetic foot and what it is. Thank you. Have a great rest of your night.